Hello, everyone, and welcome to this first session of a five-part series called Mental Health and the Second Wave. This is brought to you by Nisama, supported by Samvad. Just very briefly, Nisama is a collaboration among mental health professionals across the United Kingdom and South Asia. It endeavors to improve research, education, and clinical service delivery in mental health. Samvad, I get the feeling a lot of the audience is very well familiar with Samvad. Well, Samvad is supported by the Ministry of Women and Child Development, Government of India. It is located at the National Institute of Mental Health and Neurosciences, that is NIMHANS in Bangalore. Samvad is an Indian national initiative and integrated resource for child protection, mental health, and psychosocial care. Now, before I take you all into the series and more particularly into today's session, I'd like to invite Dr. Aditya Sharma, who leads the Nisama endeavor, to tell us a bit more about this venture. Dr. Aditya Sharma is clinical senior lecturer and honorary consultant in child and adolescent psychiatry at the University of Newcastle, UK. Dr. Aditya Sharma, over to you.
Thanks, Isha. A very warm welcome to everybody. Namaste. I'm Aditya. As you know, I'm originally from India, probably left 20 years ago, as you can tell from my accent, and now live in the fabulous city of Newcastle and work in the northeast of England. I just wanted to say a very, very warm welcome again to everybody. I understand we've got more than 540 registered delegates. That is the biggest turnout we've had ever for a webinar launched by Nisama. But as I said before, huge thanks to Samvad. Nisama was really born out of discussions that I had with Shekhar, and it's in some ways our attempt to work collaboratively across South Asia so that the UK can learn from the skills and expertise that exist in South Asia. We have a huge expat population in the United Kingdom that would benefit from gaining skills and expertise and cultural sensitivity. And likewise, hopefully, the UK will have some skills to offer our colleagues in South Asia. So not going to say very much more. Hopefully by our next webinar, we will probably have our website completely up and running. So I will share with you the website link. And this webinar is of course being recorded, so will be made available freely on the website as well. So thanks a lot to Shekhar, Samvad, and of course Isha for coordinating this.
Thank you very much, Dr. Aditya, for that introduction to Nisama. Well, this series, Mental Health and the Second Wave, is going to be a series of discussions about common and distinct issues that have surrounded mental health and have probably consumed us in parallel as we battle the fear and the struggle that the COVID-19 pandemic has brought us into. I must say we are very encouraged by the response to the series with almost 600 registrations from 11 countries. It is going to be my personal goal to make these discussions relevant and meaningful to all of you, all of us. And to help me do that, I'd like to specify some housekeeping rules that we must abide by through the series. Very quickly, we will begin and end each session on time, so please make sure you're logged in. You will notice that you've been muted by host upon entry. This is just to maintain session decorum. If you're invited to speak or if you'd like to ask a question, you will be unmuted. We have a substantial time for questions in all of these sessions. You could, for a start putting your questions in the chat box as the session proceeds, because I know there are so many participants. It might make more sense for me to club questions in similar areas of inquiry for the benefit of the panelists and the audience. Lastly, it would be really nice if we can have as many videos on as possible, but of course, that's the only not mandatory rule. So please feel free, depending upon your network connectivity, to have your video on. Thank you for all your cooperation in sticking to these rules as we move. Well, moving into today's session now, the theme is COVID-19, a childhood in crisis. I am joined by three illustrious professionals on this panel. I welcome to the session Professor Shekhar Seshadri, who is the Dean Behavioral Sciences and Senior Professor of Child and Adolescent Psychiatry at NIMHANS, Bangalore. Dr. Mohammad Mohsen Hassan is the Medical Director and Head of Psychiatry at Melat Medical Complex in Kabul, Afghanistan. Dr. Gunjan Dhonju is Consultant Child and Adolescent Psychiatrist at the Kanti Children's Hospital in Kathmandu, Nepal. While Dr. Shekhar brings in decades of insights and experience from work in both clinical and community-based child and adolescent mental health work, Dr. Hassan and Dr. Gunjan will help us understand the experiential realities of children from two very unique sociocultural settings that are Afghanistan and Nepal. Before I invite the panelists to speak, I'd like to take a couple of minutes to clarify the scope of today's session. When we say a childhood in crisis, how do we interpret this? Are we referring just to, so there are children and suddenly the COVID-19 pandemic has come and they all find themselves struck by this crisis. So is it just A hits B and that's the crisis? Or are we talking about a childhood being spent in crisis? Can any of us tell how long the pandemic is going to last? Do we know when we will finally get out of it? So is it this child now, or is it going to be this childhood for the better part of their life? What does crisis feel like when you talk to one single child, when you work with one single child? Is it one child's crisis versus what happens when we look at an entire generation, generations, if you will? There is a child in each one of us, and I'm sure every child is facing crisis in the current context. And looking at it, a bit differently, what do children do in crisis? I constantly feel we're consumed and overwhelmed with with thoughts and worries about what do I do as a clinician, what do I do as a professional, what do I do as a parent, as a caregiver. But if we are to step aside from those roles for a minute and think about what do children do in crisis, what is it like for these for children and adolescents to be going through whatever they are in the current times. So that's really kind of setting a picture for you, and it's especially important to look at it from the children's perspective, because even as we see headline after headline telling us the really despicable circumstances that a large majority of children find themselves in, the project Protect a Generation study by Save the Children, which looked at the impact of COVID-19 on children's lives. This was a survey done across 37 countries that interviewed thousands and thousands of parents and children, found the children and parents and families are really performing poorly on a lot of measures that span healthcare, that span education, that span social security, that span well-being in general. And finally, to say that the large majority of children are moving towards poverty, violence, child labor, child marriage, while in parallel, rights that children rely on to survive, thrive, and be safe are continuously diminishing and are likely to diminish further the longer this pandemic goes on. So even while headline after headline is telling us about this, are we really asking children? Are we asking them, when we make decisions about ourselves, about our families, do we include them as part of all of these discussions that seem to be really important in the current time? So when you do ask children, as Save the Children project did, when you do ask children, what do you find? Children basically talk about the same issues that all of us adults are preoccupied with. They talk about education, child poverty, social protection, health, governance, protection from violence. And these are some statements that this report has quoted from many different countries, where children really seem to be experiencing, and they really seem to be a big part of this tragic reality that we find ourselves in. And just to briefly touch upon, there are realities and then there are realities. What I mean by that is a child who is already, let's say, suffering from a mental health problem, a child who is already going through a tough time for medical, psychological, social reasons, there, the circumstances and the reality become that much more serious, become that much more intense. I'd just like to read the first one of these quotes here on top of the screen, which is from a 19-year-old boy that I personally interacted with in the last couple of weeks, who said to me, quote, "Losing my mother to COVID has made me more aware. I couldn't fulfill her dreams of me joining college while she was here. God has given me an opportunity to grow up. But then sometimes I think she's just in the next room, that nothing has changed. I don't know what will happen now." Unquote. What is this about? Is it about tragedy? Is it about hope, opportunity? Is it about grief, loss? I mean, you can think the entire spectrum of issues and emotions that are perhaps going through this young person's mind. Um, with that, ladies and gentlemen, with just introducing you to the potential that today's session could take us through, the potential discussions that we could possibly open up, I'd now like to invite our panelists to respond to the theme. Dr. Gunjan Dhonju, could I request you to first tell us about your thoughts on today's theme?
Thank you. Thank you, ma'am, for the introduction. I'm Gunjan. I'm working as a consultant in Child and Adolescent Psychiatry Unit in Kathmandu. So since the COVID-19 pandemic began, and even after we had this second wave, what we have felt is like it has affected children across Nepal uh, in an unprecedented manner. Being in such a way that like we have the only child psychiatry unit in the country. So that is also situated in the capital city, Kathmandu. And our annual reports also show that since a couple of years, almost 45% of the yearly patients, they are usually from outside the Kathmandu Valley itself. So, and there's like travel restrictions nowadays because of the lockdown, because of the COVID. And even when the lockdowns were lifted, it was difficult for them to travel all the way back to Kathmandu, even for treatments and all. So what we noticed is like there was a huge crisis in terms of mental health because whatever services they were getting, it was already difficult for them before the COVID, but now it's almost become inaccessible. So what we had to do to sort of reach them was, start some teleconsultation services, which we began from the last wave itself, and we have continued that even in this wave. And even in between the two waves, the daily cases, they are not normalized to what we used to see earlier. So it still means that, the help-seeking behavior might have come down, and because they don't want to come to the hospital. They fear that they might contract COVID and all sorts of things. And it is definitely not because the mental health issues are becoming less. I mean, it's increasing, but they're like more hidden now and more out of reach. Thank you.
Thank you, Dr. Gunjan. Some very pertinent issues there. Help seeking is coming down not because mental health is improving, certainly not. Mental health is probably becoming worse, but the practical difficulties that the pandemic has brought on are keeping people in their homes. They are refusing to come to hospitals to get help, even when they might really need it. Thank you for bringing that up. I'm going to ask Dr. Hassan to come in now. Dr. Hassan, are you there online? Okay. Okay, I think Dr. Hassan may take a little, I can see him. I think he has join. Dr. Hassan, can you hear us?
Yeah, do you hear me?
Welcome. Please tell us.
Yeah, at the beginning, thank you, dear Professor Sharma. Thank you for the invitation and communication during last week's. And hello to everyone, especially to my honorable Professor Shikhar Shishadri sir, John sir, Siryushi ma'am, my direct supervisor when I was in NEMHANS, Rajendra sir, and Swami Shri sir. I would like to brief you about the percentage of children in Afghanistan, family size and estimation on orphan. The situation in Afghanistan is very different with other countries. Nearly half of Afghanistan's population is under the age of 15. About 47.8% of the population is under 15 years. The average family size in Afghanistan is 8%. It is very different from neighbor countries and other countries around the world. And also the estimation of orphan in Afghanistan is 1.6 million children. Unfortunately, they lost their both parents or one of them due to war and diseases. The pandemic is a crisis for today's children. The school closures are one of the most visible and controversial means by which COVID-19 is affecting children. Children and young people are among the victims of the disease that suffers the most. Unfortunately, a majority of children in Afghanistan already affected by different crises such as war, violence, and also the poverty. The current COVID-19 crisis was the situation. And as I discussed when I was in NEMHANS, unfortunately, I say this, we have only 4 beds in a psychiatry hospital in the capital of Afghanistan. We have no any child center and for treatment of children in the country. That is clear. We have no any center to the families bring their children for diagnosis and for treatment. But in the different private hospitals, doctors, they treat the children and they see them and prescribe medication for them. But the situation is totally different with other countries, especially with the neighbors country and India, because we have no any specified hospital for children and specialists in the country. This is the situation and the crisis is universal and for some children the impact will be lifelong. As we know, the harmful effect of this pandemic will not be distributed equally around the countries, because as I mentioned, the situation is totally different with other countries in Afghanistan. And also we have people, they live in the urban area and also the rural area. They have no total access to the medical health system, and also the government cannot support all people as well as the children in the country. This is the total situation, and I would want to add one thing more, that if the already stressed national health system are completely saturated, large number of infants, children, young people, and pregnant women, mothers will die due to factors other than the coronavirus. Similarly, most nutrition programs as well as local programs for the early identification and treatment of malnourished children have been disrupted and suspended in the country. This was the brief information about the situation.
Thank you very much, Dr. Hassan. I think when we interpret this theme as a childhood spent in crisis, I think Dr. Hassan has just helped us understand what that means, how it's actually playing out in his country, where there is crisis upon crisis, there is a stretched uh, government, health systems, and what is that like? How does one understand that? How does one respond to that? I'll now ask Dr. Shekhar Seshadri to give his thoughts in response to the theme.
Thank you very much, Isha. You know, George Orwell once said all men are equal, but some are more equal than others. And in a perverse twist of this statement, one may almost say all children are not equal, but some seem to be more unequal than others. And this seems indeed to be the truth of how the pandemic is kind of playing itself out. I'd like to beat together what Gunjan and Hassan have said to really step back and take a perspective on COVID and children and the kind of crisis that forms the essence and the subject of this evening's session. If you look at wave one, when we really started in February, March last year, before the lockdown was announced in India, both the narrative and the reality for children was of a certain nature. The reality was loss of structure, loss of routine, loss of predictability, loss of educational opportunities, loss of social spaces, and loss of play. This reality was also compounded by a consternation and confusion about what this whole thing was about, and the kind of fear that had already started, you know, with the sanitizing and the masks and the kind of media stuff that were going on. And there was a built up of anxiety, and a certain anxiety communicated from caregivers to children as well, and basically a restriction of both their internal and their external ecologies. And the narrative then was, what is this, you know, how long will this last? And, you know, or it should end soon, isn't it? And, you know, after all, this is not a visible enemy. This constriction is not by a visible enemy, unlike, let's say, children in the Holocaust who had to constrict themselves and hide themselves for an extended period of time. Or, for example, children who grew up in institutions. If you look at the Romanian adoption studies of Michael Rutter and what happened to the development of those children who were in institutions where care was inadequate and they were shifted out, and care improved. So that was the first wave. And then there was a period of quiescence, and then the second wave, hit us like a punch in the solar plexus when we were least expecting it. And the narrative has shifted now. The narrative is now about loss and grief. Let's not forget that in the first wave, the concern was about the elderly with comorbidities. And in the second wave, it's healthy adults without comorbidity, you know, 50, 55 years, even those who were vaccinated, who are being taken away. And now we are having this whole issue of COVID orphans, and having to deal with the extra stuff of loss and grief, and even placement of children, some of whom have lost both parents. And now there is this anticipated third wave, and the narrative has changed. This is going to go on for quite long, isn't it? There is really no defined end in sight. And throughout this narrative, all the other anxieties about what's going to happen to our social circles and networks, what about those who are 16, 17, 18-year-olds and their exit exams? Will there be a gap here? What about their aspirations? And then look at children of migrant workers, children of daily wage workers, children with special needs, and what that means for the crisis that they are in. But Isha, one of the really critical things that you pointed out from an anthropological perspective, a generation in crisis. Now, if you look at an infant or a newborn during the COVID, somebody who was born in 2020, even if a child had been born pre-COVID or whenever this damn pandemic goes away, by and large, till about a year, year and a half, they are more or less cocooned within families. They may be taken out once in a while, and that's okay. But for the 3-year-olds and the 4 years old for whom developmental needs are very critical, and what happens when they are almost, in some ways, uh, constricted, isolated, may I dare say, incarcerated, and then, of course, the adolescents with their own frustrations about their social lives having been disrupted, with all the attendant anxieties and their aspirations set. So we have many nuanced and complex crises within this crisis. So to go back to what you said, Isha, it's not just about A hitting B. It's also about an individual child. It's about children and childhood in general, but it is also a generational issue which mental health would need to address, because it'll become this has not happened. It's after 100 years that an entire world has been brought down to its knees, and it is now that the child mental health fraternity and indeed the mental health fraternity has to get together to really examine what we need to do to prevent a generational damage being done for developmental trajectories and other mental health consequences of this pandemic, by ensuring that their developmental needs, their aspirations, the questions and anxieties and concerns they have in their mind are adequately answered, so that 2 years from now, 5 years from now, hopefully it will all seem like a bad dream, as opposed to there being long-term impact of the nature that we see in many situations of this nature. Over to you, Isha.
Thank you for that, for really explaining to us how, so how that there's been, you're very right in saying that there has been this complete shift. So even for children to process that, a year ago they were telling me, grandparents, if somebody is really ill, COVID-19 may hit them. So, and children were trying to understand that. And now that, the pandemic has really hit them very close in terms of their parents are going away, the entire family is getting impacted. So the shift in the nature of the infectivity and, the contagiousness that this virus has come with is obviously something that is a big struggle for the entire generation to understand, like you pointed out. But let me follow that up, getting into some questions and answers now. Sir, if I can stay with you, because you spoke about loss as something that was a major theme, is a major theme, will perhaps be a major theme as we move along this pandemic. But I want to ask you, what is, how do you understand, how do children process loss happening around them? Because the large majority of children are hearing about loss, so somebody in the neighborhood died. On the TV, they see so many people have died. So there is so much exposure to news about death and dying and loss. What is a child's response to that? And how do we, what do we need to be aware of when we are with children in this time?
A lot of that depends on the age of the child and the extent to which this reality, these images, and personal affectation are either immediate to them, intermediate to them, or kind of distal, and how these experiences are actually processed by the caregivers. Let me explain this a little further. That let's forget about COVID for the time being, and let's look at the experience of loss for an average intelligent child who is not an infant, who may still experience loss because of attachment experiences or lack of them. but someone who has enough sentience and consciousness to actually process the absence. That now, if you know that a parent, a relative has, let's say, a malignancy, ill for 5 years, in and out of hospitals, multiple surgeries, chemotherapy, radiotherapy, secondaries, metastasis, slowly fading, there is a sense of preparation. Even then, there is a loss. If there is a 90-year-old great grandfather or great great grandfather who is invested well, but is slowly fading away, has an extended family of 135 people, 70 of whom manage to gather, and another 65 get on Zoom, and everybody's there, and he fades away. Some of these are logical stories of loss, but many stories of loss are not that logical. Absolutely healthy father just goes out, run away by a truck. Absolutely healthy father, some risk factors, first fatal heart attack, or some difficult parent, some difficult father is in and out of hospitals, passes away. There's a lot of whispers going on that he was not a good man. He had many relationships, and then HIV, he had HIV. Now, the story here, in terms of the struggle for hospitals, the struggle for ICU beds, the struggle for concentrators, and the premium that is being charged, and the kind of anger and frustration that it creates on the one hand, or the panic at not being able to find places to go to, how that then structures the nature of loss that you feel. Because what is added to that is frustration and anger with the system, anger with people who did not help or who were not supportive. That so, given the current situation, it's important to keep in mind that the nature of loss and grief has a certain universality, that everybody is experiencing it in more or less a known framework with different elements. In a given case, that somebody was COVID positive but had comorbidities, and in any case, there were health issues, as opposed to an absolutely healthy 42-year-old father who has COVID and has such a reaction that, within 48 hours, he's gone. And how does a bright 10-year-old make sense of this sense of loss? That to understand sometimes that uh, viruses do not necessarily follow any logic or any rules of compassion and empathy. Just as someone who dies in a motor accident because of a tire burst, and it was a day where the machine failed the man. So how do we reinterpret loss and allow them, therefore, to grieve in ways that then they can come out of the confusions, the consternations, and the frustrations of this time in a healthy way? Over to you, Isha.
Thank you, sir, for those nuances. I'm going to ask Dr. Hassan to come in here because sir has just, Dr. Shekhar has just, spoken about, so everything is about the context of the loss. Who is this child? Who has this person lost? How did the death happen? And when we're looking at unexpected deaths, losses, young people dying, parents dying, because you mentioned that there are so many children in your country where they may already have lost a parent and now they run the risk of losing the second parent to this pandemic. So in your work, when you're dealing with children day in day out who may have suffered all of these kinds of losses, um, can you share with us some of those realities and how you deal with them in your work with children in Afghanistan?
Professor, we visit some children only in Kabul, in the capital of Afghanistan. When they lost one of the parent due to war, and during the COVID crisis, they lost their mother or father. Um, they suffer from the mental problem very seriously. And first, the people, most of the people, they don't have awareness about the mental health, especially about the children mental health issues. They take them to the religious clerics and they talk them to the shrine. After the case became worse and very serious, after that they bring them to the hospital. In the hospital as well, they face with the general practitioners. They also don't know about the mental health problem of the child and adolescent. This is the case here in our country. But when they know and the doctors gave them the address of the mental health hospital in the Kabul, they bring the child or the children to the hospital. We face many children in such cases. They have depression and also they suffer from anxiety, and also at the first they have the bereavement and grief, and after that they face with the panic disorder. On the hospital, we prescribe them medication, and also we have psychologists for adult. We assign them to talk with the children and to aware the family about the cases. And we follow that children when come to the hospital for future treatment. But unfortunately, we have no enough beds, and we have no enough psychiatrists, especially in child and adolescent psychiatry. This is the worst scenario.
Right. So what you're, so what you're telling us is that the reality is that there is a lot of mental health impact from all these different kinds of losses. But once this reality meets socio-cultural practice or socio-cultural behaviors and habits, then perhaps more often than not, it may end up becoming a problem. And we as mental health practitioners need to be aware of both of these realities, that yes, there is loss and mental health impact, but at the same time, there is also going to be a societal response that one needs to be aware of and take it into account as we assist children. Thank you for that. Dr. Gunjan has been working with a school-based project, which I believe is being run by the UNICEF in Nepal. And could you share some insights about, what is that project telling you, and what are you really learning about children in this pandemic?
Thank you, ma'am. So the project that we ran, it started in the first wave of COVID. We called it Identification and Management of Child and Adolescent Mental Problems related to the COVID-19 pandemic. So that's not exactly a school-based, but one of the areas that we reached out to were schools for ease of access. Because we realized that since children were not reaching us, we had to reach them in some way or the other. So something that sort of materialized after a couple of months of the first wave was that they started conducting online classes in schools. So we saw that maybe that could be a good platform to tap into. So we started reaching out to some schools in Kathmandu to see how things would go, and then things are quite positive. They welcomed us for the sessions, and then we developed a simple manual that we could use to train other mental health professionals. So we did some sessions with schools and then got some feedback. So it was basically focused around, talking about COVID so that the children could share about their experiences and all. And then we would also talk about identifying stress, any kind of symptoms that they would have because of the stress. And here the stress was basically secondary to COVID is what we were considering. So, and then what are the things that could be done on a regular basis, either in home or in school, so that their stress could be somewhat minimized and they could, continue functioning to a certain level and then when to seek help, when to know that things are going bad, and who to reach out to. So the session basically covered these areas. After that, we reached out to some community-based organizations as well, some professional uh, groups of people as well, like it could be members of a bank or somebody. So basically, we wanted to reach children and adolescents as well as adults around children and adolescents. So we also had sessions for teachers, we had sessions for parents, we had sessions for other caregivers, like those who work with children, let's say in childcare institutions, childcare homes. So we had sessions for them as well. So we had sessions for children and adolescents, and for the adults who would be, immediately in their surroundings. So the whole objective was somewhat to sensitize all of them so that, the mental health related aspects could be considered during interactions during this difficult time, so that they would be more mental health friendly in a way. So that was the whole objective. And when we did that last time, we were able to reach 40,000 plus people directly through these sessions. So that included half of them being children and adolescents, half of them were the other adults. So that ended in February of 21. But then again, the new wave has started. So we are restarting it. And this time we are also planning to reach out to, isolation centers where children have been kept, and some team members are visiting there with PPE and everything. So they're having some sessions there. And we're also planning to have sessions for children with HIV in Nepal, because we were not able to reach out to them in the last wave. So this time we are planning to do that. So we are planning to coordinate with some, there's this HIV network in Nepal, which the UNICEF works closely with. So we are coordinating with them in a way to sort of reach out to them as well. And some sessions for healthcare workers and all. So that's how what we were doing.
Right. So I think that's a real big take home for all professionals on this group, that where children are not reaching you, it's your prerogative, it's your responsibility to reach out to them. And I think that is what Gunjan and his team are doing in Nepal, that they're reaching out wherever there are children and whoever's around children. What are your needs? What are you seeing? What are the issues that are coming up? And look, here's a list of A, B, C, D, first steps that you can take, first step that you can give in this context. Thank you so much for sharing that. I think now it's time for me to move into questions from our audience. And there have been quite a lot of questions. So thank you, audience, for that. Like I said, there are questions that have come in through the chat box, and some of our listeners also sent in questions via email. So I'm just going to try and pool together so that we can answer many of them. The first question is from Jarapla Srinivas Naik. I hope you're on the session now. So his question is, my kid who is 20 months old, when she was born, there was first lockdown. And now second wave, amidst of this situation, we are unable to take them out of home for outdoor playground. And now the third wave scares us, saying that children or kids are probably more at risk. So in this situation, what are your suggestions for parents? How to manage the situation, how to take care of kids, especially in the future third wave of COVID. So Jarapala is talking about very young children, 20 months old, toddlers, and asking about, what to do with them, because these children, like Dr. Shekhar was pointing out, this is key time for social emotional development. And this is the time where these children have to be kept indoors. Sir, if I can actually take this question to you.
In fact, Isha, I would like to combine it with a question that Ishwaran has also put on chat, which is what will be the impact of loss of conventional education and play for kids. What we have been saying for the last 1 year, in some ways as an overarching principle to what Hassan and Gunjan have said, no time else has the importance of public child mental health been more sharply needed than now. And what we are saying, therefore, is very simple. If children cannot go out into the world, how do you bring the world back into the homes, into childcare institutions? And here is where the wonderful work of Rudolf Steiner, um, the Austrian philosopher, and his work in anthroposophy, that branch of philosophy that deals with the optimization of human potential in all domains of child development, in homes itself. How do you keep, hand functions, sensory motor exercises, visual tasks, play, stoking their imagination through play and creativity, so that there is no loss of learning opportunities and no loss, indeed, of imagination. You can have a loss of structure, a loss of routine, and with school closures, a loss of educational opportunities. But you need not have loss of imagination. And there are so many creative ways in which public child mental health, when you take community approaches through non-professional service providers and the kind of networks that Gunjan is talking about, and in the absence of core service providers of the nature that Hassan has spoken about in Afghanistan, how do you use other networks of people who have contact with children? And they could be completely non-professional service providers to really keep these developmental processes going. So that's the way that one would take public child mental health in this time of COVID.
Thank you, sir. I'm going to move on to a related question. So, so the one aspect of this is that today children are not getting social exposure, play, and everything that sir spoke about. The other aspect is what's going to happen 3 years down the line. What's going to be, so this child who, so these, at least we know that 2 years are blocked in terms of optimum exposures. So what's going to happen 3 years down the line, 4 years down the line? Dr. Gunjan, if I can ask you to take that question. So can we predict, is this going to have long-term impact, and what might that be?
Well, it definitely feels like it's going to have a long-term impact, especially for a country like Nepal, because uh, there were already struggles related to, education, literacy, enrollment of children in schools, preventing dropouts or preventing child marriages, child labor, vaccination, vaccination-based preventive diseases, and all. So, uh, so what's going on nowadays is like people are suffering in different levels and in different aspects of their lives. Like it could be the economy, it could be loss of somebody in the family, loss of social support, loss of possibly education, loss of health facilities, and all of that. So, so because of this, I think whatever goals that Nepal had made, that it was planning to achieve in the coming year, like there were Millennium Development Goals, and there were like goals about reducing the child mortality rate or infant and child mortality rate, maternal mortality rate, and getting control over some communicable illnesses. So I think all these are going to suffer, very strongly. And directly, indirectly, a lot of these are related to mental health. So there is definitely going to be a mental health crisis in the coming days, especially because we are currently seeing, since the last 2 years, a rise in developmental issues in the presentation of children in our OPDs. And these are not children who have had, history of perinatal complications. These are children who got trapped inside their homes, could not go to school, could not interact with anybody, were basically exposed to digital screens a lot. Parents were busy because they had to work from home. So, there was a lot of understimulation going on, so which I think has definitely affected the developmental aspects of these very young children. And even the older children, they've not been able to, go out interact with others, go to school, and also. And recently, what we have seen is since almost every household, let's say in Kathmandu, either there have been people who have been infected or they have been vaccinated. So it's like the saturation is very high. And for families where there have been loss, like the young ones are now afraid that they're going to lose the other family member. So teenagers who have lost one family member, they are like developing some, anxiety related symptoms and all, and they're really worried. And for, for a valid reason as well, that, somebody else might get infected again in the family, I might lose somebody else. And so all those things are going on. So yeah, hopefully things work out, but it does seem like the pandemic has definitely caused problems for the future to come, and it's going to be quite a challenge. Thank you.
Right. I think what you're saying is so important because, while we are trying to understand that what is today happening to this child who has lost, or who is grieving, or who has a mental health issue, but the problem isn't just restricted to this individual space, isn't it? It's the multiple layers of environment around this child, and each layer is now affected. Like you're saying, the sustainable developmental goals are completely off track. So not only is this child, suffering within the family, which is probably, going down in terms of family income, moving towards poverty. There is loss of education there, but at the same time, the entire society, the community, the country, and also the entire world. So every layer that could potentially do something to provide a protective shell for this child to adequately grow and flourish in, all of those layers are now impacted. And which is how, we can predict that long-term development, long-term outcome is perhaps going to be affected. I'm going to take the next question to Dr. Hassan. This is a question from
Isha.
Yes.
Sorry, Isha, it's Adi. Sorry,
Please.
could I just say just a couple of things from a UK perspective? I was just very intrigued to hear. So I think, as most people know, we have come out of the UK mortality has been the highest probably for a country as small as ours internationally. We've not done very well with COVID. But what is good is that I think children's mental health has been a priority for the government, and they have been very keen to reopen schools, as in face-to-face teaching and delivery of schools as soon as possible. I think just in addition to what Gunjan just said about developmental issues, what we're noticing here is that some primary school age children are actually showing signs of regression. So the skills that they had acquired, such as the ability to write, the ability for phonics, the ability to speak, string sentences together, they are losing that. We don't know exactly why. I think I think Gunjan's already described the understimulation, parents having to work from home, and it's the same situation. Sometimes not having access, how does a family with 5 children who have maybe one phone access online teaching? It's not possible. We don't have solutions to it. I think that somebody's already asked a question about autism, but just one little anecdote from the UK perspective is that during our first lockdown last year, the patients who did the best were the ones on the autism spectrum, because they were not having to interact. They could control their environment. And what we found harder is when the lockdown ends and the reintegration poses a lot of challenges. But sorry, that's a very UK-centric perspective. I'll be very intrigued to hear what the South Asian perspective is. Thanks, Isha.
Thank you, Dr. Aditya. And I think that, again, closely, your what you said about autism ties in with what Dr. Shekhar was earlier talking about, understanding the child's context. So what were this child's, what were the temperamental, developmental needs before a crisis struck or before something happened that could potentially have social emotional impact? So that is where the importance of the individual and the context really comes in. So Jagjit and Soumya have asked related questions. I'm going to read out Jagjit's question because it's in front of me. Dr. Hassan, if you could respond to this. So they're saying, in case a child happens to see the loss of his parents before his or her eyes, and he or she is in a post-traumatic situation, what will be the therapeutic way to make him or her normal and face the reality? And just to clarify, Dr. Soumya also asks about the same thing, where she basically says that as a psychologist, what do I need to keep in mind while dealing with children who have COVID in their families or who may have COVID themselves? So it's all about very, very personally getting impacted by COVID. And how do we as mental health professionals respond to such a situation?
Sorry, Sharma, ma'am, I didn't hear you clearly.
So what?
I think my connection is weak here.
Okay, I can repeat.
Do you want me to take this, Isha?
Sure, sir. If yeah, probably you could.
In the interest of, so I'd like to bead what you have said, along with many other issues that have come up on chat as well, particularly about communication with child and how important it is to keep communication going, because silence does not help. And but we must understand that communication is also a process, and it's a question of gently speaking to the child and breaking the news. So what happens is that if a death has taken place in front of your eyes and you've experienced, there is a visual image, and the extent to which it is almost in a post-traumatic kind of phenomenology, as opposed to loss and consternation and confusion. Depending on that, the issue is, as someone often says, when a man is drowning, that's not the time to teach him how to swim. You save him first and you can teach him swimming later. Now, that's the time essentially for containment, for reassurance, to look at placement and safety issues. Where would this child, um, to validate the child's emotions, to acknowledge the depth of the loss, to understand the complexity and constellation of feelings involved, um, and then help process this loss experience in a manner based on the age of the child, as to the kind of questions and dilemmas that the child has in his or her eyes, or in his or her mind, to be able to take the child through those processes of conversation and communication. So there is no prescription for this. It really depends on, are we talking about a 4-year-old, a 9-year-old, a 16-year-old, someone who was actually close to the parent, or not that close. That, see, there are so many issues that make a difference in the way that grief is. So grief is both a universal experience, but it is also a very personal experience. And how an individual then experiences it, and you help process it, really makes a difference of how to negotiate. And in this context, also to quickly mention, because there is a lot of stuff coming about education and online stuff and so on. Let's understand that online education in the digital world had come to stay even before COVID. And it is going to continue after COVID, and perhaps get extended because of how much we have learned about the use of the online world and the digital media. The idea is time management and judicious use. It's about a family plan. It's about understanding that the digital world is one part of experience and existence. But there is also human contact. There is creativity. There's imagination. There's pursuing hobbies. There is nature. There is music. There's education. There's reading, writing. There is aspiration. And there is the digital world. So this is not to say that you can wish the digital world away. You cannot. This is something that we need to keep in mind. So a democratically arrived at family schedule, or a family um, time, that how do you manage family time, and a family plan that the family has a plan for, and those recommendations are already there based on the age of a child, how much uh, screen time should actually be allowed. Over to you, Isha.
Thank you, sir. And thank you especially for addressing the virtual world question. I could see a lot of those popping in on the chat, and that's always a difficult thing to answer. So we are at 5 p.m., and as promised, we are going to close the session on time. Um, Before I do that, if I can ask, and this is open to any of the panelists who'd like to respond to this, if there is something constructive and positive that we can move forward with from this pandemic. I mean, for the better part, the pandemic has wreaked havoc. It has created a lot of problems for all of us. But if there was something constructive and positive that only the pandemic could have taught us, what would you say that is? And how can we take that forward?
Yeah,
Gunjan, please go
something
ahead.
about this. Yeah. Uh, well, what I'm going to say is not just true for this pandemic, but something other than that that has happened in Nepal before. Like we had the 2015 earthquake, and then now we are going through a series of pandemics, right? So uh, mental health never actually got focused in Nepal until there were crises. So after the 2015 earthquake, there was like an uproar of uh, talks about mental health. So it suddenly became the cool thing to talk about, possibly in the political benches. And so what happened is, one of the things that happened after that was the establishment of the Child and Adolescent Psychiatry Unit in Kathmandu. So had the earthquake not happened, it might have been delayed. Possibly it would have happened again. I mean, it's not a good thing, but in times of crisis, possibly that's where people start talking about mental health, because that's when they are concerned about it. That's when these things start becoming important in a more visible manner. Although it was there before, but it's not prioritized much. So even now, because of the COVID, there have been so many similar kind of activities going on. Like, for example, we now have something called a mental health subcluster meeting that happens almost every 2 weeks, where a psychiatrist in WHO from Nepal, he sort of hosts it, and then there's people from all different parts of the country who are working in mental health. So it could be a medical college, it could be an organization, some from our team. So it's basically, it's sort of brought everybody together to start talking about these
Right.
things.
Thank
So I
you.
think,
Thank you, Gunjan. So pandemics put mental health on as an agenda of priority. Well, that's one positive that we can certainly take from this, and which also means we must react to it with that much seriousness. And if I can just quickly summarize some important things that we have touched upon today: assisting children through this crisis, assisting childhood, generations of children through the crisis, is about having conversations, is about reaching out and identifying early. So it's really putting public child and adolescent mental health on the map. It is about understanding and working with the family as a unit. You're no longer working with the mother or the father or the child. You're working with them as a unit, because this unit is together. We don't know, locked in for how long. So it's about understanding the family and working within that system. And like Dr. Gunjan summarized so well, it's about recognizing the importance of mental health as a key mediator of the final outcomes of what this pandemic is going to do in your city, in your country, in the world. Thank you all very much for joining in this afternoon. I'm grateful to all the panelists for sharing their wonderful insights. We will meet again on June 16th. That's a Wednesday at 4 p.m. Thank you very much. Have a good evening. Bye-bye.
Namaste.
namaste. Thank you.